All right, let's get right into it. The word agitation, we hear it all the time, right? Someone's agitating a situation or a topic is agitating. But in a clinical, medical world, that same word means something completely different and way more serious. Today, we're going to close that gap and really unpack what's happening when a person is experiencing clinical agitation.
So, just for a second, think about it. When you hear that somebody is agitating, what picture comes to mind? For a lot of us, it's probably someone stirring the pot, maybe being dramatic for attention or deliberately making a scene. And that, right there, that everyday understanding, is exactly why it's so critical to understand the medical definition.
And here's where you can see the difference, clear as day. On one hand, you've got the common meaning, which is all about choice, manipulation, maybe a bit of drama. But on the other hand, you have the medical reality. Clinical agitation isn't a behavior someone chooses. It's a symptom, a visible sign of an absolute storm of uncontrollable turmoil happening inside someone, and it's often a red flag for a serious underlying issue. So this is the official definition we're working with. Think of it like a pressure cooker. There's this intense internal restlessness and tension building up inside, and it has to come out somehow. That's where the increased physical movement and verbal activity come in. But the most crucial part to remember is right at the end. It is not a choice. It's a symptom, just like a fever is a symptom of an infection.
Okay, so what does this state of agitation actually look like? Well, it's not just one thing, it's a whole spectrum. And knowing the signs is the first step to recognizing it. So let's break down how this internal chaos shows up on the outside. This is where that internal pressure I mentioned literally spills over into physical action. We're not talking about simple fidgeting. This is constant, aimless movement, like pacing back and forth with no purpose. It can be repetitive motions, like wringing hands, tapping, or even pulling at their own clothes or hair. In more severe cases, that energy can escalate into aggression, and it makes it almost impossible for the person to accept help, even when they need it.
And it's not just physical. Agitation totally changes the way a person communicates. That inner chaos comes out as speech that's really fast, loud, and feels pressured. They might become argumentative for no clear reason or get stuck in a loop asking the same question over and over. It's a sign that their thoughts are moving too fast for them to organize them properly. Now, this slide gets to the heart of the internal experience. Can you imagine feeling this overwhelming wave of anxiety and tension, and at the same time having this terrifying feeling that you're losing your grip on your own mind? Thoughts are just racing, jumping from one thing to the next. And in some situations, especially if psychosis is involved, there could be paranoia or hallucinations, making the world feel like an incredibly frightening place. And of course, the body is right there in the thick of it. This isn't just in someone's head. The body's fight or flight system is kicked into overdrive. And that leads to very real, very physical symptoms: a pounding heart, sweating, trembling, and muscles that are just completely tensed up. This high alert state also makes sleep almost impossible, which just fuels the fire and creates this vicious cycle, making the agitation even worse. So we've seen the what, but that leads us to the most critical question of all. Why? Why does this happen? What's at the root of all this distress? Before we dive into the list of causes, this is the single most important idea to lock in. Agitation is never the actual problem. It's a warning signal. It's a loud, flashing red light telling you that something else, something medical or psychiatric, is wrong. The real goal is always to figure out what that something else is. Generally speaking, the causes fall into three big buckets. You can see them here: psychiatric disorders, a whole range of medical and neurological conditions, and then issues tied to substance use or withdrawal. So let's take a quick look at each one. In the world of psychiatry, agitation is a pretty common feature. It's a classic sign of a manic episode in bipolar disorder, where there's just so much energy it has nowhere to go. It can be driven by paranoia in schizophrenia. And it can even show up in a specific type of major depression, fittingly called agitated depression, where a person feels that deep sadness, but also this awful restless energy at the same time. Now, this is so important. Agitation can be your body's alarm bell that something is physically wrong. A sudden state of confusion and agitation, called delirium, can be sparked by something as common as a bad infection. We also see it a lot in dementia, after a head injury, or even because of metabolic problems like a haywire thyroid or dangerously low blood sugar. And finally, you have substances. They can play a huge role from both ends. Being intoxicated on stimulants, for example, can directly trigger severe agitation. But on the flip side, when someone's body is dependent on a substance like alcohol and they suddenly stop, the withdrawal can be marked by intense agitation, shaking, and anxiety. Okay, so we're dealing with a really complex and serious symptom. How do professionals even begin to manage a crisis like this? Let's walk through the approach, the path to calm, when someone is in that acute state. The game plan has 3 crystal clear goals. Number 1, above absolutely everything else, is safety. Safety for the patient and safety for everyone around them. Number 2 is to help calm the person down, but, and this is key, without completely sedating them. The goal is to de-escalate, not knock them out, so they can still participate in their care. And number 3 is to start the detective work to find that root cause. The approach here is really logical. You always start with the least invasive methods first. So step 1 is all about the environment. Make the space safe, quiet, and calm. That means dimming the lights, reducing noise, and having fewer people around. Step 2 is using communication, specific techniques for verbal de-escalation. And only if those things aren't enough do you move to step 3 and consider medication. Now, verbal de-escalation sounds a little clinical, but it's really just a powerful communication skill. It's about using your voice and your body language to bring the tension down. It means speaking calmly, respectfully. It means saying something like, "I can see you're having a really hard time," instead of arguing with them. It means keeping your posture open and non-threatening. Even avoiding direct, intense eye contact can help because that can feel like a challenge to someone in this state. And when medication does become necessary, it's not a one-size-fits-all thing. The choice really depends on what's suspected to be the cause. Think of it like using the right key for the right lock. Benzodiazepines are great at quickly reducing anxiety and are a go-to for alcohol withdrawal. Antipsychotics, on the other hand, are a better choice when the agitation seems to be fueled by things like paranoia, which you might see in schizophrenia or a manic state. So we've covered the what, the why, and the how. But let's tie it all together and ask the most important question. Why does this all matter so much? Why is it so crucial to take this seriously? Well, the risks of not managing it are incredibly high. The most immediate danger is physical harm. A person who is highly agitated is also highly impulsive, and they could hurt themselves or someone else without meaning to. They can also prevent medical teams from providing life-saving care. And over the long run, leaving agitation untreated just makes the underlying condition worse and can completely destroy a person's quality of life. And this, right here, is really the bottom line of everything we've talked about. This is not something you just wait out or hope goes away. Recognizing the signs early and getting professional help is absolutely vital. It is the only safe and effective way to manage the immediate danger and protect the person when they are at their most vulnerable. So I want to leave you with a practical question, something to really take all this information and bring it into the real world. After everything we've gone over, the intense internal struggle, the loss of control, the very real risks, if you ever see this happening in someone, what is your first move? The answer could not be more clear. This is a medical emergency. You do not try to handle this on your own. Your first and only step should be to contact professional help. That means calling an emergency service or getting the person to a hospital. It is the safest, smartest, and most compassionate thing you can do to start them on that path back to calm.